Hello, everyone. My name is Dr. Kara Amstutz. I am a veterinarian and I practice in Springfield, Missouri. I focus on pain management, rehabilitation, and really just anything I can do to help my patients live a longer, happier, healthier life and keep themselves moving. So, I was asked by your group to talk about the development and maintenance of healthy bones and joints throughout your dog's life. No small task, and I will definitely do my best to cover all of the listed topics. But if I don't, uh, I'm sure we could visit it another time about some of the additional topics. So let's get started. First, what I'd like to do is thank you guys for asking me to share some of my knowledge and my passion for helping dogs live healthier, longer lives. I've really enjoyed learning about your breed. I've read a lot about their characteristics and what they like to do, and I think that they're a really cool breed. I have a few patients, a few Bouvier patients, but I didn't get to know them as much until I've done some research, and I'm really I see the allure of wanting to have one of these kids. They seem very cool. So, just a little bit about me. Like I said, I'm a veterinarian. I've been in practice for 21 years now, and I did general medicine for 14, 15 years and decided I needed a little bit more of um, I needed to be pushed a little bit more. I wanted to learn some new things, and I also wanted to help my patients in ways that I couldn't. I started to get frustrated with just the traditional, if I had a painful patient, rest and pain relief. I wanted to have other ways to treat them. So about 2012, I started a long process of getting certified in a variety of modalities such as acupuncture, rehabilitation, pain management. And then in 2017, I started a residency in the American College of Veterinary Sports Medicine and Rehab. And I am on the tail end of that. So I'm doing what's called an alternative track. So I fulfill my residency requirements while I work full time. So I'm a little busy, but I love it. I wouldn't have it any other way. So, to talk about how to have a long, healthy life for our dogs, we kind of need to start at the very beginning when it comes to how bones develop. And what you need to know is that when puppies are still in utero, the bones start to form and they start off as just cartilage. And while they're still in utero, those bones actually begin to ossify or harden. And we can see that on x rays at day 45 gestation. So if you've ever wanted to have your bitch pregnancy checked and wanted to do it sooner than that, it just takes 45 days for those bones to ossify enough to be able to see them on x-rays. So it's not that we're trying to be mean and make you wait any longer. That's just the way the bones develop. And the bones develop in two ways: intramembranous ossification, which is making bone between connective tissues. And that type of ossification is responsible for flat bones and increasing the width of bones. And then there's endochondral ossification, which is how bones grow in length. So here's a schematic of endochondral ossification. And this is the vast majority of how bones are formed. So again, they start off as cartilage, and slowly along the edges of the bone, they start to form periosteum, which is ossified bone. And then some blood supply comes to that area, which helps it form even better and quicker. And then, kind of in the center of the bone, there will be a primary ossification center, which begins to expand and grow towards the ends of the bone. And then at the ends of the bone, there are these little secondary ossification centers that start to grow. And as you see, they work towards each other, and eventually the gaps close. Now, the gap is what's called the growth plate or the physes. And that is an area of concern for large or giant breed dogs, which abbreviate is a large giant breed dog. So that is why I wanted to talk about how these are formed. So if we look at that gap or the growth plate a little more closely, this is a picture on the left is a histopathology slide presentation of that growth plate. And there's different zones that have as the bone um, matures, the different zones have different areas and kind of what the bone's doing. So we have at the top, we have the zone of reserve cartilage, which is basically a resting zone where the cells that make cartilage are relatively inactive. This is kind of at the end of the bone or the epiphysis. Then we have the zone of proliferation, where there's rapid cell division happening and the cells kind of stack up. And this is actually the area where the bone elongates and grows in length. Then the zone of hypertrophy is where the cells actually become enlarged and start to calcify. And then at the bottom, we have zone of calcification where the bone actually turns from just these hyaline cartilage cells to actual bone cells. So the picture over on the right is an x-ray of a young dog, and you can see there are lines along the growth plates here and here and here and here. This puppy has a lot of open growth plates. And when a veterinarian looks at these x-rays, sometimes when the growth plates are open, it can be a little bit harder to read x-rays. And the timing of these growth plate closures can vary. So one of the things that we want to look at is how do these growth plates look? Are they closing appropriately at the appropriate times? So let's look at that. Here's a little chart that goes into the different areas of a variety of bones and kind of when they close at the earliest age and when is the latest age that they close. Now this chart is based on a medium-sized dog, like a 50 to 70 pound dog. And what we know is smaller breed puppies, like Chihuahuas or Yorkies, their growth plates close much earlier, whereas large and giant breed dogs, their growth plates close much later. So for example, the last growth plate typically to close is on the hind limb at the tibial tuberosity. And on this chart for a 50 to 70 pound dog, it starts to close at 10 months and then usually it's completely closed at 12 months. But in a giant breed dog, that can close between 18 to 20 months of age. So that's significant when it comes to risk of injury and thinking about diet and some of the other things that we'll talk about later. And we know that there is a rapid growth that occurs between the age of 3 to 6 months of age. And by 9 months of age, most dogs are at about 90% of their adult size. However, like I mentioned, large and giant breed dogs, they can take longer to reach their full adult size. So when it comes to the different things that happen to, make a healthy joint, we want to know where can things go wrong. And that there's kind of 4 big areas of problems that can lead to joint issues in dogs. One, their ossification can become disrupted. So that process that I just showed you, going from hyaline cartilage to an ossified bone, it can become disrupted. Another problem is that the vascular supply leading to helping the ossification can also become disrupted, and that will lead to problems. Rapid growth is a huge issue that we need to control and discuss so that we don't increase our risk of having problems with these puppies. And then trauma. Trauma obviously is a little hard to predict and sometimes hard to prevent, but that definitely is a potential for causing problems with these puppies in their joints as they age. So all of those things can lead to what we call developmental orthopedic diseases. And this is a list. It is not a all-encompassing list. There's many, many other diseases that can develop in a young dog. And we typically see these types of conditions happen in the first 26 weeks of life. What I've done is the red highlighted conditions are very common in large and giant breed dogs, with Bouvier's being a breed that could have these conditions. The other two are less common, but I want you all to know about it because they do occur in large breed dogs, and I just think it'd be a good idea for you to know what to watch for. Then the rest of them, are things of interest. But again, we're not going to go through each one of these. I want you to know that there are a lot of things that can happen in these puppies as they age. And thankfully they're pretty rare, but it's something to watch for. So the first thing we're going to talk about is hip dysplasia. And what we know is hip dysplasia is most common in large breed dogs, but we can also see it in small breeds and even cats. And what happens is a normal healthy hip joint, it's a ball and socket joint, but the ball doesn't fit into the socket joint tightly. It's not snug. And so there's what we call laxity, meaning the ball can kind of pop out or subluxate out of that socket joint. When that happens, that causes further degeneration of the joint, meaning if the ball's not fitting in the socket snugly, it actually can hit up against the socket or the acetabulum in a way that it deforms the acetabulum or the socket. And over time, that leads to an altered biomechanic of the joint and osteoarthritis. So, underlying cause of hip dysplasia, we know that there's definitely a genetic component because there are certain breeds that have a much higher percentage of hip dysplasia, such as German Shepherds. We also know that excess calorie intake can lead to rapid growth and rapid weight gain, which increases your risk of hip dysplasia, as well as heavy exercise. So there was a study done in Norway that looked at certain breeds of dogs that are larger breed dogs that are definitely at risk for hip dysplasia. And they looked at uh, exercise and what the dogs were allowed to do when they were young. And what they found was dogs who were able to just have kind of normal daily activity, kind of off leash walks on kind of a variety of terrain, had reduced risk of hip dysplasia compared to dogs that were allowed to do stairs at an early age. So the thought is, kind of higher concussive forces, higher activity increase the risk of hip dysplasia in these dogs. So that's interesting. And it's most likely to be a problem if this heavy exercise is happening when the dogs are younger. So here is just a few x-rays that show kind of the radiographic progression of hip dysplasia. The one on the left is a radiograph of a puppy. You can see that it's got open growth plates. And the ball is the femoral head. And then the socket is what's called the acetabulum. And again, this should be seated nice and snug. And what we have here is what's called subluxation. So this area here between the femoral head and the acetabulum is widened. And so that's some subluxation. Here we have a dog with some moderate hip dysplasia. Our socket or our acetabulum is getting shallow. There's hardly any coverage of that femoral head. The femoral neck is getting thickened and it's kind of an abnormal shape. And there's some early arthritis happening here as well. Now on this picture over here to the right, this dog, this hip has actually had a surgical intervention that we'll talk about here in a moment. But if you look here, I mean, this looks nothing like a normal femur. The femoral head is not a ball anymore, and the socket looks just almost more like a flat plate. So this is not going to be a nice and functional joint. So one thing to think about hip dysplasia is what we call a biphasic disease. So we see symptoms at 2 points during the pet's life. Usually between 4 and 10 months of age, we'll see things like bunny hopping, difficulty rising. You might even hear a clicking sound as that hip joint is kind of being pulled out of socket and then getting sucked back into the socket joint. That can sometimes cause a click sound. Also, you might notice that the dog is shifting its weight to the front limbs, and they might be unable to exercise for extended periods. And you would think a 4 to 10 month old dog should have a lot of activity, but if you have a puppy that's not wanting to, take a walk or be able to play ball for any length of time, it could be that there's a painful underlying process going. And the the reason why they show signs at this point is just purely due to laxity, that the ball and socket is not snug, so the femoral head is subluxating out. And what that does is that stretches the joint capsule, and that's painful. When the joint capsule that's supposed to hold things together gets stretched, it's uncomfortable. And then over time, what happens though is the joint capsule and the surrounding tissue actually begins to kind of form some scar tissue, and it firms up. And actually, between the puppy age and at when they get older, the dogs can actually look pretty normal. They might have a little reduced hip extension, and they may have a little bit of change in their gait, but a lot of times they look pretty normal and the owners don't really even notice a problem. But over time, secondary arthritis will form. And that's when we'll see the second phase of clinical signs in older pets, where they've got progressive lameness. They're more lame after exercise, so they're more painful after exercise. They'll start to lose muscle mass in their pelvic limbs. These are the dogs that look kind of big and barrel chested up front, and these little skinny hind ends because they're losing muscle mass. They're shifting their weight off of their hind limbs towards the thoracic limbs. And also owners will notice problems with, transitions, getting into the car or up on the bed, difficulty with the stairs, things like that. So there's basically two types of treatment that we can look at for hip dysplasia. Conservative, which would be like weight control, making sure we're providing proper exercise, providing pain relief, protecting the joints. Rehabilitation, which is what I do, to work on strengthening all of the supporting musculature, and anything that we can do to maintain range of motion of the hip, especially hip extension, is important, and muscle flexibility. So the conservative therapy, typically what we do, depending on the age of the pet when it's diagnosed, if we're too far beyond some of these surgical options, we try conservative until the conservative just doesn't work any longer, and then we look at surgical options. So surgical options, there are a couple that if we can catch hip dysplasia early in life, then we have the opportunity to treat these patients with a little bit less invasive option, and that would be the juvenile pubic symphysiodesis, or JPS, easy for me to say, JPS surgery. So the JPS surgery, what that is, it is a minimally invasive surgery that closes the growth plate at the bottom of the pelvis. And what that does is it results in selectively growing the parts of the pelvis that allow for improved coverage of the ball. So the acetabulum has better coverage of the femoral head. And as the puppy grows during the next few months, that improves over time. The trick with the JPS is that we need to get hip dysplasia diagnosed and the dog in for surgery no later than 18 weeks of age. I've seen surgeons do the procedure in dogs older than 18 weeks of age, but I think the best results are if you can do the procedure before they get beyond 18 weeks of age. So that part can be tricky. You have to have a very astute pet owner or someone who is looking for hip dysplasia in their dogs at an early age. Now, the next procedures are the double or the triple pelvic osteotomies. Those procedures can be done in dogs usually between no older than 8 to 10 months of age, and they can have no evidence of arthritic changes in the hip joints. What is done with this procedure is actually the surgeon goes in and they cut the pelvic bone in either 2 or 3 places and rotate the segments to improve coverage of the ball by the socket, so that with the goal of decreasing the laxity of the hip. Again, you have to catch this early because if they have secondary osteoarthritis, and that makes them not a good candidate for this procedure. So if you have an older dog who you don't get a diagnosis until maybe a year old, and there's already some osteoarthritis present in that hip joint, that's when a total hip replacement is the ideal surgery. It is, the dog does have to be skeletally mature, so their growth plates have to be closed. And what this does is basically it's just like in a person. Um, you replace the hip with a new ball and a new socket, and the um, the implants are placed with bone cement, and there's pegs present, and they basically press fit the implant. And I've got a picture to show you of this, of all of these procedures here in a moment. But the benefit of the total hip replacement is that it mimics a normal hip, and it reduces the pain uh, associated with hip dysplasia, and it allows for a natural range of motion and the most normal function postoperatively. The problem with hip replacements is they are pretty expensive. And out of all the orthopedic procedures, they don't have a high complication rate, but it's higher than others. And so, it's an expensive surgery that if things go wrong, they can go real wrong. And you definitely would want to if you were to be looking at this procedure for your dog, you definitely would want to be talking to a board certified orthopedic surgeon and somebody who's done this procedure a lot, and that you can ask, what is your complication rate? What's your success rate? How many have you done? So that you feel comfortable with this procedure. The final procedure is what's called a femoral head and neck excision. And this is basically a salvage procedure where the surgeon goes in and removes the femoral head or the ball. It's completely removed, which that removes the source of pain, which is great. But now we have to rely on all of the soft tissue, the muscles and the tendons and ligaments and joint capsule, all of that soft tissue surrounding that area has to form scar tissue that eventually causes what we call a pseudo joint or a false joint. Again, the pet isn't painful, but if you don't follow up with postoperative rehab, then the problem is that scar tissue can really reduce the dog's range of motion of that false joint. So they typically have reduced extension of the hip. And the other problem with femoral head and neck excision that happens, that causes a functional change in the dog's gait, is that once that the femoral head is removed, the leg actually is shortened because there's not a proper joint there any longer. And when the limb is shortened, it causes a discrepancy and will cause a lameness. Again, the pain is gone. So most pet owners are really happy with how their dog does after a femoral head and neck excision. But you should know that it definitely will cause an abnormal gait. So if you had something like a show dog, it would pull them out of the ring. It would not allow them to continue working in that manner. So here are just some pictures of some of these procedures. The one on the left is a DPO or double pelvic osteotomy. The one in the middle is, the first one is just the before picture. And then the second picture in these two photos shows a total hip replacement. So this is the ball and socket implants with this deeply seated implant down along the femur. And then this last picture is the femoral head and neck excision. So here's a normal side, here's our ball, and here's our socket. And you can see there was just a cut right here along the femoral neck. And now we have nothing articulating with each other, which is good because that reduces the pain. So the next thing to talk about is elbow dysplasia. Again, it's very common in large to giant breed dogs. 80% of cases are bilateral, meaning both elbows are affected. Anything to do with the elbow, I'm just going to say, is frustrating to veterinarians, rehabilitation specialists, surgeons, anybody who's concerned about pain and mobility in dogs. And the reason why elbow conditions are frustrating is because, if you think about a hip joint, it's a ball and socket joint. So it can go forward, backwards, out, in. It can, there's a lot of range of motion. If a dog hurts in one part of the hip, they can compensate and shift their weight around and take the pain away from themselves. However, a elbow joint, it just flexes and extends. It's a hinge joint. So it doesn't have a lot of options. And if there's pain or if there's a pathology really anywhere within that joint, it's painful almost all the time. So that's what makes elbow problems frustrating in dogs. There's less room for error. And when they start to have problems, it's very obvious. What we know is that elbow dysplasia is kind of a collection of problems. We see fragmented coronoid processes, which is the coronoid is a little protuberance on the ulna inside of the elbow joint. So a little kind of a beak on the end of the bone that can fracture off and kind of float around the elbow joint and cause pain. We see OCD lesions, which we'll talk about those in a minute. And we see joint incongruity, meaning just the three bones, the humerus, the ulna, and the radius, just don't line up quite right. And because this joint really requires fine movements of those three bones, if it's not lined up correctly, it can really cause problems. And then finally, we can see an ununited ankylosing process. And the ankylosing process is also part of the ulna. You can see in this picture here, this is the ankylosing process, and that actually, the closure of this growth plate doesn't happen correctly, and so this can actually break off as well and cause really quick development of osteoarthritis in the elbow joint. So the etiology, we know it's multifactorial. I looked on the OFA website, and they ranked Bouvier's 43 out of all the breeds that get elbow dysplasia. So, it happens, and it's something that y'all need to be aware of. And we think again that there is part of the problem is a defect in how the cartilage is formed. Trauma can also be a part of the issue, and diet. We're going to talk more about diet, but generally, puppies who are overfed high energy dense foods, that can lead to increased risk of elbow dysplasia. So again, treatment options are conservative, such as weight control, providing appropriate exercise. So anytime I have a patient with an elbow issue, the big thing I do not want them to do is any jumping activity, any jump down activity. So jumping off of an apparatus or jumping out of a car, off of the furniture. That is a concern for me because it's just going to cause intense pain right on the elbow joints. We also want to provide pain relief with things like NSAIDs and additional medications we'll talk about later in my presentation. We've got joint injections that we could look at. We want to protect the joints with things like Adequan, and then nutraceuticals are also an option. So those are things we'll talk a little bit more about later. Surgery for elbows can also be kind of frustrating because, again, it's such a small joint, and by the time we get a diagnosis of elbow osteoarthritis, oftentimes the surgery isn't very rewarding because there's already secondary arthritis there. So what the surgeon can do is they can go in arthroscopically, so a small camera into the joint, and if there's a piece of loose cartilage, they can remove that, which is basically like removing a rock out of your shoe. So it definitely reduces pain. If it's the ununited ankylosing process, they can reattach that. They can also, there are some surgical procedures where they can make some cuts in the bone to help correct that incongruity or the way those three bones interact with each other. And I think that's really interesting. And what that does is it can kind of offload the areas that are bearing too much weight and causing increased pain and cartilage damage. And then also there's a total elbow replacement that I know some veterinarians are doing. I've never seen one. I've never had a post-operative case of a total elbow replacement. I visited with one of the board certified surgeons that I work with on a regular basis, and he feels like though they have potential, but at this point, he probably wouldn't do it on his own dog. So that might maybe give it a little bit of time and a little bit more research to decide if that's the best option for your dog if your dog has elbow problems. So the next condition is what's called osteochondrosis dissecans, or OCD. Again, large and giant breed dogs are predisposed. Typically, we'll see signs between 4 and 8 months of age. Sometimes we don't see it at that point. We see it later in life with when they've got secondary osteoarthritis. Um, Typically, we'll see a lameness that gets worse with exercise. Uh, there are kind of some common locations where we'll find OCDs: shoulders, elbows, the knee joint or the stifle, or the talocrural joint, which is the tarsal joint or the ankle joint in a dog. And what we know is, again, lots of different potential etiologies: genetics, rapid growth, overnutrition. Also, if we provide too much dietary calcium or protein, trauma, ischemia, or loss of blood supply, and even hormones can lead to OCD. And I did find a report of Bouvier's having, uh, in a particular study where they looked at the incidence of OCD in dogs and, kind of when it's diagnosed. In that particular population of dogs, Bouvier's were the number one population, having 15% of the dogs had OCD lesions in the shoulder. So I thought that was interesting. I don't think that 15% of all Bouvier's have OCDs, but it was interesting that in that particular study, they were very highly represented. So how do OCD lesions develop? Well, what we think is that a portion of the cartilage on the end of the joint fails to ossify into bone. And because of that, it becomes thicker, a thicker area of cartilage. And that area now is at increased risk of injury. What can happen is necrosis or cell death can occur around that thickened area, and it causes a fissure to form. And then actually the cartilage forms into a flap, and the flap can actually completely come apart and float around the joint. And then it can mineralize and get bigger. And that will definitely cause pain and increase osteoarthritis progression. So over here on this picture, this is a dog's shoulder. And this is a very common area to find OCD lesions in dogs. This is the caudomedial aspect of the humeral head. And this is the little flap, and you can actually kind of see a little line forming around this flap. I just had a patient in last week, 10-month-old Bernedoodle, who has a very prominent weight-bearing lameness of the forelimb that has that flap is already broken free and is ossified and is floating around in his shoulder joint, and it's very painful. So again, when it comes to treatment options, we have conservative, and basically what we recommend is all of those things, weight control, pain management, protect the joints. Give that a go for maybe 6 weeks, or if the patient is, under 6 months of age. But if they're older and or you see no improvement, again, going into that shoulder joint or whichever joint is affected to remove the flap and kind of clean up the necrotic tissue. What that will do will remove that source of pain, and also kind of encourage fibrocartilage or kind of scar tissue to form in that area. While the surgeon's in there, they'll lavage or they'll flush the joint to remove any inflammatory cytokines or all the little hormones that cause osteoarthritis to progress. So kind of clean up the joint. And definitely there needs to be some activity restriction after surgery, but the dogs have a much better quality of life once they've returned to normal activity. And really, any of these cases that have surgery should have postoperative rehabilitation. We know, just as in people, if you have a major orthopedic surgery, your doctor doesn't tell you, okay, now just go home and do nothing for 8 to 12 weeks. They say, take it easy, but let's get you in with PT so that you can, not lose range of motion. You can hopefully maintain and start to regain muscle mass. You can maintain your flexibility so that once the bone itself is healed, you can go back to normal activity a lot faster than starting completely from scratch at 12 weeks after surgery. So the same things have been found in veterinary medicine. Rehabilitation helps these kids get back to their normal activity much, much sooner. Okay, so the other couple of conditions that I just wanted to make you aware about, one is called hypertrophic osteodystrophy. We call it HOD. Large and giant breed dogs are mostly affected, usually between 2 and 8 months of age. We think there's a higher incidence in males compared to females. We don't really know the underlying cause. There's all kinds of suspected underlying causes when it comes to HOD, maybe food related or um, minerals, trace minerals, things like that. But more recent research shows that there is some sort of an inflammatory component. Um, Typically, what we see clinically is that the dog will have an acute onset of lethargy. So really tired, reluctant to walk. Usually, they have very painful, swollen, warm areas along the long bones. Typically, it's both legs, um, and it's usually symmetrical. And sometimes the dogs can become systemic, meaning they run a fever, they can have weight loss, loss of appetite, and they're depressed. They can even get skin infections and can actually get pneumonia and even possible death. So it's not something that we want to mess around with. The area that of concern is kind of right on this picture, right here, right where the long bones end. So the metaphyseal area. So near the joint, near the growth plates is where we'll see the problems. So here are some X-rays of a dog with HOD, and it has a really what we call pathognomonic, so a very common presentation on radiographs. It actually, because of the inflammation that is happening at the site, at the growth plate, it almost looks like we've got a double growth plate. So there's two lines here. And what's interesting is you can have a dog showing clinical signs of pain right at the joints and even lethargy and not wanting to walk and take an x-ray and it looks pretty normal. And within 48 hours, it can look like this picture here on the left. So if you ever have a dog that's having swollen, painful joints, warm, swollen, painful joints, especially if it's a puppy, and you take x-rays and the veterinarian says, oh, you know what, it looks pretty normal. Maybe if the dog's not doing better in a day or two, have them take another set, because if they happen to look too early in the course of the disease, they may not show those double physes or double growth plate appearance. And this picture over here on the right, what is happening here is we've got secondary proliferation of bone. The body's funny. If there's any problems with a joint, the the body naturally wants to just add more bone to try to stabilize and try to make things better, which new bone added near a joint isn't necessarily the best thing to help. Um, that usually regresses as the condition goes away. But it is something that needs to be monitored. The patients usually, once the growth plates have closed, this usually goes away. We don't typically have this happen long term. So, how do we treat HOD? Well, basically, we have to provide supportive therapy, and it really kind of depends on how severe the clinical signs are. Many dogs, we can get away with just providing them some pain relief and rest. There is some studies that show prednisone, which is a steroid, works better to reduce that inflammation, and especially in certain breeds, like Weimaraners do better with prednisone. If they're not eating, if they're dehydrated, we can put them on some IV fluids and provide additional pain relief. If they've got pneumonia, then definitely we'd want to look at putting them on antibiotics. Again, evaluating nutrition, making sure they're not getting oversupplemented or overfed to make sure that things aren't, we're not pushing those bones more than we need to be. But again, the prognosis is good because again, once the growth plates have closed, it usually is self-limiting. So again, like I mentioned earlier, if you happen to have your pet evaluated and the x-rays are normal, but the pet isn't doing better within a couple of days, I would ask for a second set of x-rays just to make sure there's not not evidence of HOD. Also, until those growth plates have closed, it can recur. Um, and one thing we also know, because this damage is right where the growth plates are forming, if there's so much damage that the growth plate actually just goes ahead and fuses, so that it stops elongating when the puppy is, before they've reached maturity. What can happen, especially in the forelimb, you've got two bones, you've got your radius and your ulna. If the ulna stops growing, but then the radius continues to grow, it can cause what's called an angular limb deformity. So, and that leads to a whole host of problems. The foot will be rotated outward. There's increased risk of osteoarthritis. So, it's definitely something you want to keep tabs on. Anytime there's an injury to a bone, especially near a joint that's involving the growth plate, that risk of angular limb deformity can happen. So you want to keep tabs on that. And because, as I mentioned earlier, there is an inflammatory component to HOD, there is some thought about maybe altering your vaccine protocol, meaning maybe not giving all the vaccines at once. That's really just for dogs who have HOD. I'm not saying all dogs should have all of their vaccines spread out. It's just for dogs who have been diagnosed with HOD. We just don't want to overstimulate the immune system if possible while we're waiting for the growth plates to close, so that our chance of recurrence is reduced. Panosteitis is kind of similar to HOD. It's an acquired inflammatory condition, but instead of involving the metaphysis or near the joint, it's actually involving the shafts of the long bone. So the length, it's in between the joint surfaces. Again, we don't exactly know what is the underlying cause. We see it in large breed dogs, German Shepherds, Dobermans, Labs, and Basset Hounds are predominantly more affected, but any breed can really have panosteitis. And we usually see it between 5 and 18 months of age. Males are more predisposed than females. Clinical signs are similar to HOD. We see acute lethargy, lameness, shifting lameness, meaning the dog just can't seem to get comfortable. They shift their weight from one limb to another. They will also have cyclic symptoms, meaning, they'll do okay for a day or two, and then their signs flare up, and then they may show signs for a while, and then the inflammation calms down, and then they do better. So if you have kind of a waxing and waning clinical signs, panosteitis may be something to consider in your pet. Instead of being painful at the joint, these dogs are painful when you palpate along the long bones. This is also usually self-resolving, but may occur up to 18 months of age. So radiographically with panosteitis, we see the medullary cavity, so the inside of this femur, and there's an arrow pointing here. It has kind of a mottled appearance. Usually that change in that medullary cavity starts near the nutrient foramen, when the nutrient foramen is where the blood supply is to the bone. And it can extend up and down and can take up the entire medullary cavity of a bone. This takes a couple of weeks to actually be visible on x-rays. And once it's present and treatment is started, it can take 3 to 4 weeks to completely resolve. Some cases will develop that periosteal new bone formation that I showed you about with HOD. And again, when that happens, it's just the body's way of trying to fix itself, but it really doesn't take care of the problem. Treatment for panosteitis, again, supportive care like anti-inflammatories, rest. This is a condition where hydrotherapy, underwater treadmill, or swimming is really helpful, because it's taking the weight off of these sore bones, and but it still allows the dog to move and maintain flexibility of the muscle and joint range of motion. So while we're waiting for inflammation to resolve, it's a good way to keep the pet active. So, just as you are aware, I'm very sure, how to handle some of these conditions that have a genetic component is to do vigilant screening of your breeding pairs. This list comes right off of the Bouvier um, website on what is recommended for health screening. So hip dysplasia, the AKC, and what's recommended on the Bouvier website is to have an OFA screening. The OFA screening is the screening that is done the most common. You have to wait till the pet's at least 24 months of age. So, and that's, considering you're looking at this pet to be a breeding dog. You're not looking for hip dysplasia because you think there's clinical signs. If you had clinical signs, you would check before 24 months of age. And on the OFA website, there was they rank these conditions based on the breed, and the Bouvier's, out of 99,342 cases, 15.6 were abnormal, and they ranked 74 out of 198 breeds. And with elbow dysplasia, we looked at those numbers, and it was out of 4,100 evaluations, 9.5 were abnormal, and they ranked 43 out of 198 breeds. So that just kind of gives you an idea of the prevalence of these conditions in Bouvier's. Now, when it comes to identifying hip dysplasia earlier, that's where the pin hip is a little bit more beneficial. So they're a little bit different. So the OFA images are basically having the pet lie on their back and the hind limbs are fully extended. They are very similar to the x-rays that I've showed you of the hip. That's the position that the OFA is looking at. And what they do is they look to see how snug is that ball and socket. How do they look? And they give them, there's different ratings. They can be fair, they can be good, they can be excellent, they can be, not good. And the benefit of the OFA is it's not terribly expensive. Most veterinarians know how to get a good OFA filmed. Some require sedation. Some veterinarians require sedation. Some don't. And the OFA does not require that they be sedated. So that is the benefit of the OFA. The pin hip, the vet has to be certified in how to do a pin hip evaluation. They also have to have a special tool to distract the hips so that they can actually get a specific position. They take 3 different positions, and what they're doing is they're measuring the space between the ball and the socket, so between the femoral head and the acetabulum. And based on that measurement, they can then determine the likelihood that the pet will go on to develop hip dysplasia and secondary osteoarthritis. So again, OFA, AKC does not recognize pin hip, but if I had a large breed dog or giant breed dog that has the potential to develop hip dysplasia, even if I wasn't going to be breeding that dog, I wouldn't, I think that getting a pin hip evaluation early, they can do it as early as 16 weeks of age, is a good idea, because if you have a pet that could benefit from that JPS procedure that I mentioned earlier, which is the minimally invasive procedure where they go in before they turn 18 weeks of age, and you can then see reduced incidences of hip dysplasia, then I think that's a good idea. So even though it's not something that's AKC recommends or recognizes, and even if your Bouvier Club doesn't look at that number as something that they evaluate for with regards to breeding pairs, I think as a pet owner, it's a good idea to have that done, just so that you have all of your options earlier versus getting to the point where you've got a 6-month-old dog and you've lost that opportunity. When it comes to elbow dysplasia, again, OFA radiographs are what is recognized. And I will say, though, sometimes with elbows, because, as I mentioned, it's 3 joints, there's a lot of interactions between each joint. And if you were to have a very small chip fracture inside that elbow joint, sometimes x-rays don't show it to you. So if you have a dog that is clinically having troubles and the x-rays are normal, really CT scans, which is like a 3D x-ray, is the way to go. Um, and then I won't get into all of the other issues, but I know, for Bouviers, having cardiac evaluations and ocular evaluations are recommended because of their predispositions. So I just included that for completeness. So let's talk about nutrition, which, I just mentioned pretty much on every single one of those conditions that nutrition plays a part. What we know is that large and giant breed dogs are just already at a higher risk for many of those developmental orthopedic diseases that I mentioned. And we know that a big reason for that is that because their growth plates take longer to close, we think that makes those areas of the growth plates a little bit at a higher risk for injury. And they're just a little bit more unstable compared to a smaller breed dog. So, other things that can increase the risk is providing free choice feeding of energy dense foods. So, what does that mean? Well, free choice feeding is nice and convenient, just putting food out and letting the dog eat whenever they're hungry. That sounds wonderful. But what we know is puppies don't have an off button. Many puppies don't. Excuse me. They don't have an off button and they just eat until the food is gone. And what happens is if we just continue to fill the food bowl up, they tend to get way too many calories. And not only are they getting too much food, but this food is energy dense, meaning puppy foods generally have a lot more calories, much more calorie dense compared to an adult dog food. And so what happens is they start to gain weight quickly, and their skeletal system just cannot keep up with that demand. We also know that if a dog gets too much food or overnutrition, that will actually cause changes to hormones, and those hormones can actually affect the those different zones that I showed you, the zone of proliferation, the zone of hypertrophy, the different zones in that growth plate. We know that feeding high overnutrition can cause hormones like insulin that will alter those different zones and increase the risk of damage. So it also increases the stability of those growth plates. So we definitely don't want to overfeed our puppies as they're growing. The other thing that we don't want to do is provide excess supplementation. And this is a biggie, guys. The thing that I have a lot of clients tell me is, especially with these, let's say a Great Dane puppy, they come in and they say, yes, we're feeding a large breed puppy formula, and then I'm giving a little bit of yogurt on top or cottage cheese on top. And the problem with this is this picture I have over here on the left is a picture I took out of a veterinary nutrition book. And I thought that it was kind of an amazing picture because it shows all the different interactions between these different minerals and things that are in pet foods or in foods that we give our pets. And it if you increase one thing, now you can see how that might cause alterations in other levels. And we just have to be really careful about supplementing different minerals because we can accidentally cause more problems than helping them. What we know with regards to calcium is calcium, if it is too much, if we have too much calcium, it can actually cause problems with how the bone is regulated. If we really want to maintain what's called the calcium and phosphorus ratio, so there should be a 1 to 1, 1.1 to 1, maybe up to a 2.2 to 1 ratio with the phosphorus and the calcium. So if the phosphorus is too low compared to calcium, those growth plates can actually get wider, which again leads to a longer period of instability in that bone. If the phosphorus is too high and your calcium is low, then dogs actually get what's called a nutritional secondary hyperparathyroidism, which basically leads to really weak, soft bones, and the pets can actually get pathologic fractures. And again, if we have too much calcium, so too much calcium is considered anything greater than 3% of dry matter fed. What that can do is that leads to slowing of those chondrocytes, or the cells that make cartilage. They slow down and don't mature like they should, which can lead to things like OCD, or the osteochondrosis dissecans. So we have to be careful with supplementing things. If when it comes to vitamin D, if we are over supplementing vitamin D, that can again lead to too much calcium. And if they have too little vitamin D, the pet can have that will secondarily lead to low calcium, which can again cause soft bones, pain, lameness, and pathologic fractures. So the big take home point is if you are feeding your dog a commercially available food, hopefully a large breed puppy food, which we'll talk about in a moment, you do not need to supplement calcium or vitamin D or protein. You do not need to supplement any of those things if you're feeding a commercially made food that's formulated for a large breed puppy. Because what you may be doing is sending some of these levels out of whack and increasing risk of these developmental orthopedic diseases. So keep that in mind the next time you think about adding some yogurt to your pet's food. So how do we know what is an appropriate amount of calories for a puppy to have? What we know is puppies have a higher energy requirement. They're growing. I mean, they grow so fast between that 3 to 6 to 9 month age. And we know they're going to reach their size, their full size. But what we would like to do is try to limit the calorie intake to allow for a slower growth. So we don't want them to grow too fast too soon, which will then lead to all of those things that we talked about earlier. And the way that we limit that calorie intake so that we slow the growth is we figure out what's called the resting energy requirement, or the RER. And basically that's a mathematical formula where you take the body weight in kilograms to the 0.75 power and multiply that by 70. So an example that I put here is if you've got a 22-pound dog, that's 10 kilograms. You take that to 0.75 power and multiply by 70, and that equals about 400 calories per day. So basically, the first time I see a large breed puppy, I'll look at their weight and I'll say, okay, they look like they're at a good weight right now. And so I'll figure out what their RER is for right now. And then I know that if they are in the age bracket of 2 to 4 months, I know that whatever that RER is, we need to multiply that by 3 times. So just let's back up. What does RER mean? That is your resting energy rate. So like that's just the amount of calories that the dog needs to take in to just kind of survive, not exercise, just kind of live, provide enough calories to do their basic metabolic functions, eat, drink, go to the bathroom. That's it. So with a puppy, we want to take that number and multiply it by 3 when they're between the ages of 2 to 4 months. As they get a little older, that energy requirement is reduced. And so we take that RER and multiply it by 2. And DER stands for daily energy requirements. And then I just included some other dog potential conditions based on, just for complete reference. If you've got an active working dog, you take that RER and you multiply it by 2 to 5. An intact dog actually burns more calories than a dog that's been neutered. So they have a little bit higher, allowed a little bit more calories, so they can have 1.8 times RER. A neutered adult dog, it's 1.6. If you've got an inactive or obese prone dog, then it's 1.2 to 1.4. And if you're trying to get a dog to lose weight, you figure out whatever their resting energy requirements are and that's all they get. So they're not getting any extra. So that's one of the ways that we look at dogs to try to determine how many calories they should have per day. Now, how do we know how to um, adjust these calories? I mean, we got these guidelines based on their age and their RER, and do we multiply it by 3 or multiply it by 2? But the other thing that we really look at is what's called a body condition score. And the body condition score is a scale that has been validated. It's been compared to DEXA scans when it comes to um, amount of fat on a body, and it is um, it's a way to just look at a dog, put your hands on a dog, and try to determine, are they at a good body weight. You know, every breed is a little different. Their conformation is different, um, but there are still some things that we across the breeds we are looking for to find out if they're at an ideal body weight. So it's a scale between 1 and 9. 1 is kind of like a bag of bones. 9 is a walking ottoman, is what I say. And 5 is ideal when it comes to body condition score. Now, 5 is ideal for just like a pet dog. If you have a dog who is an athlete, you might want them closer to a 4, 4.5. If you have a dog who has terrible arthritis, you want them at a 4 to 4.5. Anytime they get above a 5 on body condition score and they have osteoarthritis, that progression of osteoarthritis is going to happen much faster because they're just having to carry so much extra weight around. So um, really we want our dogs to be between a 4 and a 5 on the body condition score. And what we're looking at is from the side view, we want to be able to see that their abdomen is tucked up. When we're looking at them from the top down, we want to see that there's a waist. They should have a little bit of an hourglass shape there, towards the hips. And when you put your hands on the dog, what we want to be able to feel is along the ribs. We should easily be able to feel the ribs. We shouldn't be able to see the ribs from across the room, but we should be able to feel them easily. And we should also be able to feel kind of the tops of the spinous processes. So that you should be able to kind of feel the top of the spine as you go down his back. That is going to help them in so many ways. We'll talk more later about, the benefit of keeping your pet lean. But when it comes to these puppies, we start off with, you've got, let's say, a 2-month-old puppy, and we figured out what their resting energy requirement is, and then we multiply that by 2. And we just know that all puppies grow at different rates, and they can be, some puppies will kind of fill out and get kind of chunky, and then they grow tall and get really lanky. So what's recommended is using the body condition score as a guide to, do I need to, start with this resting energy requirement, multiply it by 3. But if the dog's getting a little chunky, maybe we need to cut the calories down a smidge. Or if you're feeding, 3 times the RER and the dog is a body condition score of 3, then we need to increase the calories. So we use the body condition score along with the calorie and what age the dog is and where they're at in their development to help figure out how much to feed our dogs. So, oh gosh, I always feel like talking about nutrition is kind of like talking about politics and religion. So um, I won't be talking about any specific diets, because I know everyone has kind of their own opinions and their favorites and what they don't like, and I'm fine with that. I just like to let people know, how to kind of evaluate a food and decide if it's really a good option for your pet. So my first recommendation is to feed a complete and balanced diet that's already made. I'm a mother of 4 children, and I have also 4 dogs and 3 cats, and run a veterinary practice and do all kinds of things. And to me, doing a homemade diet is just not sustainable, but it may be to you. And we'll talk more about that here in a moment. But for the vast majority of folks, feeding a commercially available food is the way that we do things. And what my recommendation would be is to feed an AAFCO diet. AAFCO stands for the Association of American Feed Control Officials. And what AAFCO does, they don't regulate or test pet foods in any way. What they do is they establish the nutritional standards for what would be a complete and balanced pet food. It's the pet foods company, or I'm sorry, the pet food company responsibility to actually formulate their food to meet those AAFCO standards. So the benefit of AAFCO again is that if they've got an AAFCO certification, it means that it's a complete and balanced food. It should be appropriate to the life stage. And why is that important? Well, if you are feeding an adult dog what's called an all life stage food, all life stage means it's appropriate for a puppy or a nursing bitch. So if you have a 6-year-old chunky Labrador and you're feeding it an all life stage food and it's not losing weight, well, that's why, because they're eating a food that's very energy dense. So you want to make sure that you're feeding the food that's appropriate for your pup. For if it's a puppy, it needs puppy food. If it's an adult dog, it needs adult food. If it's a senior pet, I would look at a senior food. Some foods are labeled for intermittent or supplemental feedings. What that means is more like treats, or if you have a dog who's not eating well, there are some diets out there that are super calorie dense that are just kind of recovery diets. So that's not something that you're going to want to feed in the long term. Now, you might see on pet food labels that this food is AAFCO uh, it meets AAFCO standards. It's formulated to meet AAFCO standards, which means the recipe is formulated to meet AAFCO standards. It's got the appropriate amounts of all the different ingredients, but it doesn't necessarily mean that they've done feeding trials. So we don't know if the pets will actually like it or want to eat it, versus feeding trials where the pets have been fed this food and it's found to be palatable. Also, you want to consider when you're trying to, decide on a food is consider the company's reputation as a pet food manufacturer. If it's a little boutique brand that you've never heard of, even though it might have a cute label, I might not just jump right on it. I would prefer to go with, maybe some of the more widely known pet food companies. You definitely want to have high quality ingredients, and that can be a little harder to discern based on just looking at a pet food label. We would like to have objective evidence, meaning clinical trials, um, not testimonials. So, any product that you read that you're reading about that product, whether it be a supplement or a food or really anything, if all of the evidence is testimony, be very wary because that means they have no data to back up what any of their claims are. Um, Also, be careful of sexy marketing. So, there's been a lot of marketing strategies when it comes to pet food. I mean, it's a huge, money making business in pet stores and all throughout the veterinary world. And sometimes things sound really good, but there's actually no medical claims or there's no medical evidence of these claims. So it can be a little scary. The whole grain free uh, situation where, we've seen these dogs having secondary dilated cardiomyopathy because they're on foods that either have a super exotic protein source or, they don't have any grains. So they've got like lots of beans and legumes. We still don't even know really what the underlying cause, is for that pathology, but we definitely are seeing an uptick in cardiac cases in pets that are fed these kind of boutique foods. So just be careful. And the people that work at the pet foods places are just excellent at selling some of these foods with minimal nutritional knowledge to back it up, which is kind of scary. So I listed several things that you can, if you're trying to decide what food to feed your pet, these are just some questions that if you contact the pet food manufacturer and ask, hey, is there veterinary nutritionist on staff. If I have questions, can I call him or her? Who actually formulates the diet and what are their credentials? How are the diets tested? Are they actually put through feeding trials with live animals, or are they just formulated to meet those APCO ratings? What kind of quality control measures do you use to ensure that each bag will be consistent? So that's one thing that I've noticed in some of these less foods with reduced quality control is, you can open up one bag and the food looks completely different than the last bag, and even though the label looks the same. So that can be a little scary. And some dogs are pretty sensitive to diet changes, so that can really make your pet sick. Also, where are the diets produced, including where are you getting your ingredients? I don't know if you remember back in 2007 or so, there was a melamine um, uh, problem. There was even with some of the bigger pet food companies, there was toxicity with melamine in some of these ingredients. And it turns out that even though the food was actually made in the United States, some of the ingredients were being sourced out of China. So that would be something that you'd want to ask. And what research has been conducted with your diet? So has there been any clinical trials, and has it been published in a peer-reviewed journal? If you've got that for a pet food, that's amazing. That you'll see that more so in some of the prescription diets, but that's always helpful to have clinical studies. And then also, what is your tracking system for recalls? So that's really important. If you're feeding a food that's been recalled, you want to know that sooner than later. And how fast do you get that information? And then what are they going to do about it when it comes to recalls? So what I would recommend for folks that have puppies is to feed a large breed puppy food. The thing about large breed puppy food is they are specifically formulated to take into all of those considerations that we talked about with regards to a fast growing puppy. So they're balanced with their levels of protein, fat, calcium, phosphorus. They also are less energy dense, so that slows their growth, and also reduces the risk of overfeeding. One thing that I used to tell my clients is that, hey, you got a 6-month-old Great Dane. Let's go ahead and just transition them to adult dog food. They'll still reach their size, but they're going to get there slower. And that is actually really bad advice. So I've stopped giving that advice. The reason behind that is these adult dog formulas are actually much lower in energy density, which you would think would be good. But for these puppies, in order for them to get enough energy to continue to grow, they end up eating more. And the problem with that is it increases the risk of getting their calcium out of balance, and they can have too much calcium, which will then potentially lead to some of those conditions like OCD and some of those other issues. So don't feed large breed or adult dog food to your puppies. The best advice is to continue feeding a large breed puppy food until those growth plates have closed. And again, for large or giant breed dogs, that can be up to 18 to 20 months. So we want to go slow with transitioning them to an adult food. Now, if they get chunky, then that's when we need to take into consideration their body condition score and maybe adjust their calories back a little bit. Okay, home cooked diets. Again, I already said this is something that it would not be doable for me, but I have several clients who, this is something they're very passionate about, and I appreciate that about them. My advice is please, please, please do not get a recipe off the internet or from the newspaper or from some magazine, because there was a study done that looked at these recipes, and most of them, like 98% of them, are not balanced. And the main reason behind that is because dogs can't make all of the minerals that they need, and they have to get it from their diet. And so if they're not being fed those minerals, then their nutrition is going to be suboptimal. So my advice is to make friends with a veterinary nutritional specialist. And there's a lot of them out there. Many of them are available via phone or online. And the one that I work with is actually at the University of Missouri. And what she requires is kind of a report or a copy of the most recent exam findings, any lab testing, like blood work that have been done. She likes to have that. And then she sends a questionnaire to the pet owner looking at, it asks all kinds of questions like what types of proteins does your dog like? Do they like beef more than chicken, or do they like fish, or do they, have you noticed any food sensitivities? So she'll ask my clients, what foods does your pet like? And then she will formulate a complete balanced diet based on what the pet likes, kind of what the owner wants to do cooking wise. And she's also available for any adjustments that need to be made for that food. So it's if you're going to do it right, is my suggestion, because you don't want to unknowingly cause problems in your pet. There is a website called Balance It, and they sell minerals that can be added to home cooked diets so that it is a balanced diet. And I looked at it. It had been a while since I looked at it, and I got on, in preparation for this talk, and they actually have some recipes there. So if you felt like you really wanted to find a recipe and not get a nutritional specialist involved, that would be the website that I would go to. Okay. So another thing to consider is what your dog does when it comes to how you feed them. So let's say let's say you've picked a brand of food that you want, but there's all, I mean, how many different, even within the same pet food line, how many different formulas are there? So take into consideration what your dog does for its job, if it has a job. Now, your dog may just be a pet dog, and just feeding a food based on their life stage is all you need to do. But if you have an athlete, such as a sled dog, um, which I looked for a picture of a Bouvier doing sled being a sled dog, and I didn't find one. I did see lots of pictures of Bouviers pulling carts, but I couldn't. I'm not sure how long those are. I'm sure they're not days upon days upon days in duration like Iditarod dogs are. So, but based on what their activity level is like, you might consider that when you're deciding what to feed. So there's kind of three different stages or three different categories that I look at when I'm trying to think about what might be the best for a dog. Endurance dogs, like sled dogs, we know that they they really rely on metabolizing fat for long term energy. So they're going to need foods much higher in fat, or diets much higher in fat percentages compared to the other two options. The intermediate would be dogs like field trial dogs, hunting dogs, herding dogs, and Bouviers definitely, that's kind of how they originated. So herding is an activity that they you may have, I may have folks here that use their dogs for herding. Kind of the idea of the intermediate is these dogs are active for 20 to 120 minutes per day. Now, when it comes to sprinter, those are things like racing greyhounds or earth dogs or agility dogs, fly balls, high jump or dock diving dogs. I know there's a lot of Bouviers that do agility. And so agility would be a sprinting type of job, because they run very quickly and they have to expend quite a bit of energy to do their jumps and their contacts and their weaves and things. And really the thought of a sprinter dog is as a dog that's going to exert quite a bit of energy, but less than 10 minutes at a time. So I didn't include food for a sled dog because I don't think many Bouviers are doing that type of activity, that long endurance activity. But for those agility dogs or sprinter dogs, what I've got written here for you are just some guidelines. So when you're looking at foods, looking at these percentages to help you make a good food choice for them. So when I've got like the protein is 24% ME. ME stands for metabolizable energy. And what that is the gross energy. So the total amount of energy in a food minus the digestible energy. The digestible energy is the calories lost to the food that doesn't get absorbed and is passed out in feces. What's left over is the metabolizable energy. So for a sprinter dog, a dog that, has burst of activity, the recommendation is 24% of protein, 30% fat, and 46% carbohydrates. The additional things, if you have a dog that you compete with, studies have shown that if you restrict their food by about 20% of the total calories, just 24 hours prior to the exercise, they seem to do better. Also, if you have, let's say you have an agility competition where you have one run in the morning, but now you've got a bit of a wait before the next run. If you have at least 2 to 3 hours before the next event, you could offer them a small carbohydrate meal after the event to kind of replenish their carb levels before their next event. You do not want to do that if you don't have 2 to 3 hours before the next event, because it increases the risk of vomiting and possible regurgitation if they're repeatedly having exercise. And then finally, at the end of the day, within 30 minutes after their last event, you can give them a glycogen replacement. So maltodextrin is the most common ingredient, and there's all kinds. I looked online, there's all kinds of different glycogen replacements. And the idea for that is you're restoring their carbohydrate level, their glycogen level in their body, which will then help to basically, what we know is the skeletal muscles need that glycogen so that they can kind of restore and be at a healthy level to compete the next day. There was a study done that looked at if you don't give any glycogen and you look at the levels of the glycogen levels after exercise, it reduces by about half. It's at like 50% of what the baseline is. But if you give them a glycogen supplement, it takes it right back to baseline. So that's really important if the pet is expected to compete the next day and maintain a competitive advantage. When it comes to the intermediate nutrition guidelines, so again, this would be like your herding dogs, the protein level is a little bit higher, and your fat level is a little higher, and your carbohydrate is a little lower. So it's recommended for these dogs to feed them a single meal per day, and with that single meal being a couple hours after exercise. Again, the restriction of the calories the day before an event can help because it reduces the chance of the pet having to defecate during the exercise. Also, it promotes burning fat for energy rather than carbohydrates, and it reduces the fecal bulk. So that helps the dog just feel better, feel lighter, and feel like they can get out there and do what they need to do. These kids would also benefit from a glycogen replenishment after exercise. Within 30 minutes after the exercise is helpful. So just real quick, this is always something that comes up when talking about diet and food allergies versus food intolerances. Both of those would be considered an adverse food reaction. And the most common allergens that we see are proteins. And out of those, it'd be things like beef, chicken, lamb, wheat, dairy. Those are the most common things that we see pets allergic to or intolerant to. And, one thing to keep in mind is pets can have clinical signs secondary to food issues that affect their skin. They can have itchy skin. They can have GI signs like recurring vomiting or diarrhea. One nutritional specialist that I worked with on a case mentioned to me that if you have a puppy who defecates more than 3 times a day, then the chances of them having a food sensitivity is increased. So that might be something if you've got a new puppy and they're having multiple bowel movements, beyond 3 a day, then that might be something that you talk to your veterinarian about, looking at what you're feeding and if there's any potential of a food sensitivity. They can also have respiratory signs. So allergic bronchitis can be secondary to a food reaction. And even there was a study done or a report done where a puppy was having hyperactivity secondary to food intolerances. So, food allergens can actually affect the central nervous system and cause behavioral changes. So it's just something to keep in mind. It's the only way to know if a pet is having a reaction to an ingredient in a pet food is by doing an elimination trial. So taking out the ingredients and watching for improvement and then slowly adding those ingredients back into the mix and trying basically looking to see what they react to. There is no blood work or even injection into the skin that can tell you this information. So I know that there are some tests that claim to do that, but they are not accurate and I would not waste your money on it. A food elimination trial is the way to go.